Now we're going to move on to our next session, which is a kidney transplant right for me? Our presenter is Samantha Mok. We just saw Sam. She's a social worker by trade and has worked for 15 years as a transplant social worker at Rush, UIC, and St. Louis University Hospital combined. Samantha's experience includes working alongside kidney, lung, heart, pancreas, and liver transplant patients, as well as with dialysis patients. She currently works at the University of Illinois at Chicago as an outreach coordinator and enjoys working for the transplant population, and I can't imagine doing anything else. Little fun fact, when I was getting worked up for transplant, Samantha was my social worker. So welcome, Sam.
Hello, hello. Good morning again. Let me share my screen, right? Is that good?
Yep.
Okay, and I can move it. Okay. So I tried to take like some of the most common questions that I got as a transplant social worker and tried to answer them in this presentation. Of course, there's not all, it's not all of them, but it's the best I could do in the time that was allotted. So, do I need a kidney transplant? That's one of the first questions people used to ask me. I'm a social worker, I'm not a physician, but the thing that I can tell you and ask you as a patient to make sure that you ask your physician about is your GFR. So your can mean that you have kidney failure. Everybody's different. Everybody has different things going on, but 15 seems to be a number where that piques people's attention. So once you've been told that you have kidney failure, you will be presented with some options. Those options typically include hemodialysis or peritoneal dialysis or home hemodialysis or a nocturnal option for dialysis. Transplant should also be presented to you as an option, whether it be a living donor option where a family member or a friend or a stranger, what we call an altruistic donor, would like to give you their kidney, or you can be listed on the wait list. So and receive a cadaveric donor. That means that when somebody passes away, that medically matches you, you would be able to receive a kidney that way. So why should I even get a kidney transplant? That's another question that people ask. That is a question that nobody can really answer for you, unfortunately. It's such a personalized choice. But what I have found is that the quality of life that dialysis for some people has taken away is the reason that a lot of people do get a kidney transplant. So a question that you can ask yourself is just, how is dialysis treating you, and how is it treating your lifestyle, or how is it impacting your lifestyle? Longevity is also something to look at. Studies, we've been doing transplants for a long time. The first transplant was in 1954, which is 67 years ago. So we've been doing transplants a really long time, and we've learned a lot. And one of the things that we've learned is that when you compare longevity and the mortality rate for people who choose to stay on dialysis or people who choose to get a transplant, the people who have chosen to get a transplant tend to live longer. So sometimes that is a motivating factor. But again, it's a personal choice. And I think it's something that I would just encourage anyone to just get as much information on as you can before making that decision and attending things like this event, right? Why shouldn't I get it? That this list is longer than the previous list, because I don't think it's a fair representation. But my bias aside, right? if you don't like taking medications and you don't like going to the doctor, then a kidney transplant isn't right for you. I can say that. I think that anybody would agree to that. You are going to have to take medications for the rest of the life of your kidney, and we'll talk about that a little bit. And if you're not going to have to stop going to the doctor. Once you get a transplant, you're going to have to follow up with your transplant team for the rest of the life of the kidney. That being said, also, there are some possible medication side effects. There are some possible depression and anxiety that then can come about after your transplant. And there are some possible financial concerns that can come about. Like I said, we've been doing kidney transplants for 67 years. So those possible side effects we as a transplant center can anticipate and we do know about. So we can try to try to prevent those. And if we do see them, we are usually very skilled on treating all of those things. So the post-care, after you get your transplant, like I said, you're going to have to keep going to the doctor. So I think that there are some maybe circumstantial reasons why people think that they shouldn't get a transplant, as opposed to some maybe lifestyle reasons. You're going to need transportation, right? You're going to need transportation to and from your doctor's appointments. You're not going to be able to drive for a couple of weeks after you had this surgery. So do you have somebody who can help you? You know, you're going to have some lifting restrictions. Do you have somebody who can help you? Sometimes those things are fixable. You just have to figure it out and get a plan. But those are some things to think about. One question that I feel like I get a lot, or it's not even a question that people even think to ask, is how long will my new kidney last? Can you put in the chat maybe how long you think that your new kidney will last? After you get a transplant, how long will the transplanted kidney last? Can't really see the chat. Ooh, lots of answers, right? Okay, so 10, 12 years, good. So a living donor kidney does last a little bit longer than a kidney that you would get from a cadaver. And so as I think I heard, it was in Doug's presentation, say, you know, that's definitely, living donor kidneys are definitely favored. But not everybody is able to get one. We know that. So 10 to 15 years for living donor, I think, is usually what we say. And then about 7 to 10 years for a cadaveric kidney is how long they last. Nobody has a crystal ball. We're not going to know for sure. But the main point that I would like to get across is that they don't last forever. I think that some people dangerously think that if you get a kidney transplant, you're good. You don't have to worry about this anymore. And that's just not true. So I thought it was important to point that out. Okay, how much does it cost? So some people think that they're not even going to entertain the notion of getting a kidney transplant because they think it just costs too much. There's not a whole bunch that I can say about this because there are so many factors that are involved. But what I can say is that if you have Medicare, which many people do, coming into the kidney transplant clinic, Medicare pays for 80% of your anti-rejection medications that you will be on for the rest of the life of the kidney. Excuse me, 80%. And if you have a supplement, that will pick up the remaining 20%. I don't know if people typically have straight public aid anymore. I know that a lot of like HMO products are coming out on the market, but if you do have straight, just regular Illinois public aid, that pretty much covers the cost. Sometimes there's like a $5 copay for those anti-rejection medications, which are the most expensive ongoing part of your kidney transplant. Private insurances, well, each plan is different. And you know, my husband and I both have Blue Cross Blue Shield, but our plans are so completely different, just in terms of what our employers offer. So what happens is that when you express interest in not just UIC, but any transplant center that you would go to, I'm sure in the country, one of the first things that's going to happen is that you'll get an evaluation by a transplant financial counselor, and they will make sure, number one, that you have transplant benefits, because unfortunately, not everybody does. But number two, they'll be able to see and maybe guesstimate exactly what your out-of-pocket costs will be in terms of medication and the surgery. The medications are the immunosuppressant or the anti-rejection medications. There's a B versus D type billing there. Medicare Part D typically pays for drugs that are not immunosuppressants. So if you're on medication for high blood pressure, or medication for diabetes, or medication for your gout, or whatever it is, then those typically go through Medicare Part D, like dog. If you are on medications, when you do get your transplant, if you do have Medicare Part B actually is what pays 80% of your immunosuppressant medication. So those, like I said, it's hard to answer exactly how much it costs. But I think the takeaway message here is just to ask for, when you're going in for your transplant, ask for a detailed analysis from the financial coordinator in terms of your coverage, in terms of transplant. I hope that makes sense. So how many medications do you have to be on? So I hear a lot that I don't want to transplant because I have to be on exactly 1,000,005 pills a day. Does anybody know? Can you put in the chat, how many medications do you have to be on after transplant for to prevent rejection? Two to three, 20, huh? Okay. 5. Okay. So Monica's right. So it does vary. It does vary for sure. But typically, people are on 2 medications that prevent your kidney from rejecting. Now, what I think is that the myth that you're on like 22 or 50 medications for the rest of the life of the kidney comes from, I'm guessing, just at first you're on pain medication, you're on stool softeners, you're on some antiviral medications that are short term. But those maintenance drugs that you are on, let's say for hypertension, for diabetes, for your gout, for your migraine, those don't go away because we only gave you a new kidney. We didn't do anything for any of the other things that you may have going on. So, So the answer is 2. We talked a little bit about the cost, but the side effects, there are some common side effects that we know that the anti-rejection medications can cause. Nausea and vomiting are a couple. But one of the reasons, like I said, that you come back to the kidney transplant clinic so often right after your transplant, is because we want to make sure that you're having none or minimal side effects from those medications. The point of the transplant is to improve your quality of life. It's not to make you sicker. So again, we do know some of those side effects coming before you get your transplant. And so we know exactly what questions to ask, as long as, you're open to communicating with us as well. So the workup, this I can tell not just from being a transplant social worker, but also being in this role, a transplant coordinator. Some people think that as soon as they get their appointment to walk into the transplant clinic, that means that they're on the list. And that is unfortunately not the case. Fortunately or unfortunately not the case. You are going to go through an extensive workup. The workup usually takes about 3 months or so. We definitely hope less than 1 year. But during the workup, you'll be evaluated by a social worker, a nephrologist, a surgeon, a transplant pharmacist, a transplant dietitian, in some cases a psychiatrist, a financial coordinator, and a transplant nurse. And Based on all of those recommendations, in addition to other recommendations, and each person varies, you know, you may need to see a cardiologist, you may need to see, you may need to get a mammogram, a colonoscopy, depending on your age and your gender. But based on all of those recommendations, we will determine medically whether or not you are medically and psychosocially appropriate to be listed for a transplant. And like I said, it takes about 3 months or so. We do a very thorough workup. And at our center, that your workup continues every year. You have to redo the workup every year, not the whole workup, but some of the workup every year until you're transplanted, because people change. You know, the way that I am this year is not, you know, how I was last year. So people change, and so we want to make sure that we are abreast of the changes. I want to make sure that you're continuing to be as healthy as you can before you can get your transplant. So some contraindications for transplant. I went ahead and just looked at our list. We have, I'm sure that every transplant center has a list of contraindications or just hard reasons why somebody is not a candidate for a kidney transplant. So at our center, if you have severe or untreated severe coronary artery disease, if you have a severe illness that impacts your life expectancy, if you have inadequate emotional stability or social support, if you have a systemic affection that is life-limiting, if you have an active cancer, if you have active hard drug use, like heroin or cocaine, not something that happened 20 years ago, but if you're actively using a hard drug, you are not a candidate at our center. We do accept patients who are actively smoking marijuana. I'm not sure what the policies are at other centers, actually. I should try to figure that out. I'm curious to know. But also if you have overt non-adherence. So overt non-adherence, you know, if your doctor says that you're supposed to come to dialysis 3 times a week for 3 hours each session, and you say that you don't want to do that and you're just not going to, or you have maybe some kind of psychiatric concern that prevents you from doing so, then that's untreated, completely untreated, then, you know, we can't really transplant somebody who is not following the doctor's advice, because that we can only surmise that can mean that you're not going to take your medications and come to the doctor after your transplant. So we're trying to make sure that the people that we do transplant are as successful as possible. And that is all I have. I have my email address and my direct phone number there. Please take it down and give me a call or email me if you have any questions. And I'll answer any questions that you might have in the chat.
Thanks, Sam. That was a great presentation. So much good information. I think we do have a question or two. Let me try to take a look. Let's see. Chat me any questions. That would be helpful. Having a technical challenge here. Okay. Okay, here's one. What about being reviewed by Social Security after transplant and they stop Medicare because you have improved? How do people then pay for meds? I think that's one big fear that people have.
That's a good question. That is a really good question. Yeah, so there's a rule that kind of doesn't make sense to me, but there's a rule that says that a Social Security rule that says that after you receive a transplant, 3 years after your transplant, you no longer have end-stage kidney disease. So if you were entitled to Medicare because of end-stage renal disease, 3 years after your transplant, Social Security takes that away, which is actually, it's the opposite of what a physician would tell you. A physician wouldn't tell you that your end-stage renal disease would go away. You just entered into another treatment option. But yeah, that's a challenge. So that's something to know ahead of time. It's something to think about and discuss with your family or your support system. There's so many factors. I mean, if you are 23 and you get your transplant, the thought would be that you and Social Security it expects you to just go back to work. Now, I know it's not easy, it's not that simple sometimes, but the thought is that you would go back to work, get insurance through your employer, and that you'd be able to get health insurance that way. If you were 65 and older, that's not true. You would keep your benefits if you were 65 and older, your Social Security benefits if you're 65 and older. So there's not a easy solution to that question. I'm sorry, I don't think I'm being very helpful, but I would just say know that, and start talking to your maybe your transplant social worker and your family to try to come up with a solution to that.
I will add to that, Sam, that one thing that we advocated for and successfully got passed, and we'll talk more about that in an upcoming session, is the immunosuppression medication bill. So that will allow Medicare to extend the coverage of immunosuppressive medication for kidney transplant recipients who don't have another means to pay for their medication beyond 3 years. Yeah. So that was legislation that we fought for very vigorously over the last 2 years, but it had been advocated for many years prior to that. It has passed, will become law, and will take effect in about a year once Medicare works through the logistics. So so that is a great thing that everybody should know, that will eliminate that barrier.
Good, perfect. It's necessary for sure.
Yeah. Okay, great. Thank you so much, Sam. This has been so helpful and so enlightening. We appreciate you.
Thank you.